we are going to record this event and post it as an Encore. That Encore will be available on our website. Let me go ahead and start sharing the material for today's event. Now, this material is designed to be just a general overview. It's not designed to be the all-encompassing material. So we've already had that particular session, and that session was available to anyone that wanted to attend. It is available as an Encore. So we will get through the basics of the material today and then move forward from there. All right. So again, welcome to the question and answer session for the Recovery Audit Contractor discussion period versus the appeals process. This information is available to anyone, and we're going to talk again about just a brief overview, and then we'll move through the actual question and answers. If we do not have enough question and answers to fill the entire event, the event will end early. Let's get started with some housekeeping. I'm going to show you more of the website as we go through. Some of the questions that we have in will bring us back to the website. So for today's housekeeping, keep in mind the presentation is available for you. It is available for download from our website. It's available from a direct download link Ellen has put into chat multiple times. Today, someone helping me is Ellen Barra. She'll be asking questions that you present in chat. As of today, I will not be taking live questions. In other words, I'm not going to open your phone line and have you ask a question. Instead, we're just going to focus on using the chat feature. Disclaimer first. The information we have for you is current as of today, and the information we have is available on the CMS website. Keep in mind this information can change and does frequently change with Medicare. So if you're looking at the CMS website, you want to follow any information available on there or any information available from the federal government and posted to the contractor guidance pages on our website. Also, if you're giving me a question today, I can only answer that question insofar as the information you give. So if you give me an answer and you don't give me the full information or something is a little bit different, that can affect the answer. So I want to make sure you're aware of that. Well, this is great for a QA session. Sometimes the information changes based on certain pieces of information given. And if you are recording this presentation, we do have to ask you to stop. CMS does prohibit this recording. CMS does prohibit anyone from recording the presentation for profit-making purposes. We, on the other hand, will record it and make it available to you. Our goal is to get that done as soon as possible. It will be available via Encore, so keep that in mind. Here's what you have to know about today's event. First, we are going to have a presentation. Again, the presentation is solely designed to cover the basic information on this material. It's not designed to be an all-encompassing presentation on any of the material. So with that said, ask questions as you get them. How do you ask questions? Use that chat feature. Each question put into the chat will then be presented to me as we go through. Now again, I will do the pre-submitted and then I will do the live questions. There'll be plenty of time. Please don't worry about that. Anything unanswered, we will send you in a document. I like to tell everybody I'm going to send that out in an email. That way you just have it available to you. If you do have things coming up after this event and you're like, wait, I got back and now I'm thinking about what he said and here's a question on that or here's a question on this, go ahead and drop us an email and we will get those follow-up questions to you. Also, following this event, and I'll explain more at the end, we are asking you to take a survey. If you take the survey, you're done if you don't have follow-up questions that arise. So in terms of the webinar today, it's a fairly easy information to get through and fairly easy thing to have happen. Again, make sure that you send those follow-up questions should they occur, and you only have 10 days. So we're going to give you till May 5th to do that. Let's talk about the agenda for today. Again, I want to explain what a discussion period is. I want to explain how the discussion period then affects and ties to appeals. And I'll give you a little bit of statistics there. We're going to answer the pre-submitted questions and then we'll move to the live chat questions. But at any given point, feel free to put information into the chat. That's how we're going to know that you have a question. Otherwise, we may not be aware of it. So go ahead and drop those in. And when we get to the live chat, Ellen will fill those out for me. There are a couple of terms that I need you to be aware of as we go through this information. First, ADR. Many of you may have heard of this. This is an additional documentation request. This is what the contractor sends you to get information about a claim. So we use an ADR and the RAC uses an ADR. We'll talk more about that as we get into a little bit more with the discussion period. Medicare Administrative Contractor is WPS. We are the ones who process your claim and your overpayments. Overpayments are key for the RAC discussion period, and I'll explain that in just a few moments. The Recovery Audit Contractor works under the Recovery Audit Program, which is a program integrity contractor. Their job is to make sure that claims are paid correctly and to target. Please note, this is not a random program. This is a targeted program. Now, when we say targeted, they go to CMS with a service, whether it is an automated or a non-automated review, and they target that. They target that service, they select the services, and they do a medical review of them. Next, you'll see the review results letter listed. The review results letter is from a targeted personal review or nurse review or medical professional review. They do have coders, they have nurses, they have doctors, depending on who needs to do the review. But it is not a system review. So you have an automated review, which is like a system. Hey, can you do this within this time frame? Does this apply to this? Meaning coding. So National Correct Coding Initiative, did we bundle something or unbundle something when we shouldn't have? Those are automated edits. Is there a frequency edit? Can you do it within a certain amount of time? Those are automated. The other one is not an automated edit. It actually requires a medical professional. And that's when you're going to get the review results letter. This is when the discussion period is most commonly used. So let's go ahead and talk about that next. So what is the discussion period? The discussion period is an opportunity for you to disagree with the RAC's medical review decision. The discussion period is 30 days after the review results letter. So you're going to get a letter. It's going to tell you, hey, we have a finding. You have 30 days to file a discussion period. Now, this is important because you can write a bunch of things down. You can explain your position. You can help them clarify information. Sometimes you're going to get a review results, and the review result's going to be unfavorable in your instance because you didn't send a piece of documentation. It wasn't signed properly. You can work with all of that information right away. Instead of having it go through, wait for the overpayment, send in the appeal, again, very long time frame. So you can get this done as quickly as possible. The discussion period, again, allows you also one other thing. So the discussion period allows you something called a doctor-to-doctor discussion. We're going to talk a little bit more about that. That seems to be one of the questions that came up. Now, you can file a discussion period in paper via fax, CD. There's a variety of different mechanisms to do that. There are available on the RAC website, and the RAC for this region, both regions, is Performant. And I'm going to show you that website in just a little while. While a RAC discussion period does apply to an initial findings letter coming from the automated review or a review results letter coming from a complex review, you can use it either way. It's more commonly used for a review results letter. That's just the normal situation that the RAC does see. So let's give you some key points just to hit this up again. The RAC finds an issue. In other words, you had a finding. The RAC sends you a letter. You have 30 days from the date on that letter to issue a discussion period request. That discussion period will then, extend a little bit into the discussion period. Here's the thing. If you don't request one, 45 days later, the RAC will come back to the MAC and ask us to take your money back because you didn't discuss this. Now, at that point, I don't want you to think that you've lost your appeal rights or anything like that. We're going to talk more about that because there's an issue going on with that as well. So we're going to talk more about that. One thing to be aware of is during a discussion period, the RAC does have the right to send you an additional documentation request. You sent in information with your request, but they still need more. They can do that. So why would someone choose to use the discussion period? Here's your advantages. One, you can submit missing documentation and actually have a medical review performed without waiting. Now, key thing there, remember, you have to wait for the overpayment to appeal that. So if you don't submit the discussion period, you're waiting 45 days after the letter, then the MAC is notified. Now we have a time frame, usually around 2 weeks, 15 days, to get that letter processed and out. Now you enter into the appeals period. That's a long time frame inside there. Also, you could never have to deal with the overpayments and the appeals process. You can simply go back to the discussion period. One of the things that's interesting is the potential to save time and money. That is how we do recommend that. It is something that is a big advantage for you. So let's talk about one other part that comes up frequently, and this is actually going to be a question from the question and answer too, was can I discuss more about the doctor-to-doctor discussion? What are we looking for? What does it mean? The doctor-to-doctor discussion is a contractor medical director who is a doctor and a doctor at your facility or your organization who represents you. The doctor must be familiar with the patient's case, information, etc. What it is an opportunity for your doctor to present their case to the contract medical director, again, a doctor from the RAC, and to go through the medical necessity, why you feel this should be overturned, or why you feel this information should be available or should be payable, why you disagree with part or all of the decision. So we want to make it as clear as possible. This is between a doctor to doctor. Now, someone asked recently, could they have a supporting staff member on there, PA, physician's assistant, for instance. And yes, you can have that person as well. However, the primary discussion is doctor to doctor, as indicated. And again, you want to look at the information given. They have to be familiar with it. Let's move on to the next slide. And the next slide just talks about the appeals. One of the common misconceptions that has come up and that I've been asked a few different times is, if I request a discussion period, do I waive my appeal rights? The answer is absolutely not. Here's the problem with the way that appeals are being filed today. First, you're appealing the claim determination after an overpayment occurs. That's not correct. That verbiage tells us that we have to look at the original claims processing date and go 120 days from the original claims processing date. Well, in some cases, these reviews are occurring 6 months to a year after that processing date. So already we're outside the 120 days. You must be very careful, and note the slide says this, appeal the overpayment. What you're actually saying is, I don't agree, I owe you this money. Here's why I don't agree, I owe you this money. So the discussion period, which will offer you that doctor-to-doctor discussion, is great, but the first 2 levels of appeal do not allow for discussion. The first 2 levels of appeal are simply documentation appeals. That's a redetermination by your Medicare administrative contractor and a reconsideration of the redetermination by the qualified independent contractor. Key thing again, make sure it's on the overpayment. Once you reach the administrative law judge, they will hold a hearing. This is up to them as to how they'll hold it. And if you have a reason for wanting it in person, you can ask for that. So when you look at this, please remember that just because you've used a discussion period and just because you still don't agree with what they have, it doesn't affect your appeal rights. Levels 1 through 5 are still available to you. The discussion period can be something that helps you overturn or submit documentation. That's one of the biggest things. One of the items that came up recently is how many appeals actually come in and are overturned that could have been handled. And we range this particular segment between 75 to 95% of the appeals coming in for a RAC decision could have been overturned during the appeal or during the discussion period had it been utilized. This saving you time, frame, and money. So you want to make sure you're at least aware of that and you're aware of the discussion period. So one of the questions that we got is, can I review the time frames for the discussion period? And absolutely, the thing you have to be aware of, oops, sorry, too far, with the discussion period is that you have 30 days to file. This means that when you get your review results letter or your initial findings letter, you have 30 days after the date on that letter to submit the request. So it's key and important information to know that. If you miss that 30 days, yes, you are going to lose the discussion period. Here's what you don't lose, the appeal rights. You still have 120 days after the date of the overpayment. Don't file an appeal on a review results letter. You need to wait for the overpayment. Our appeals department has to dismiss them as we have nothing to look at because it's filing on a claim. We don't even have the overpayment yet. So keep that 30 days, 30 big days in mind. Again, we talked a little bit about this, but I wanted to show you this form. This is the discussion period request form from Performant. Now, Performant, again, is the recovery audit contractor for the regions that are under WPS jurisdiction. So this gives a lot of information. Here's your 30-day time frame right in this sentence right here in the opening paragraph. This is a downloadable form. When you download the form, please type this form. Don't handwrite it and then try to scan it back in or anything like that. Now, you could do that for a signature, but they ask that you please type it because they've had a lot of clarity issues and they can't read it. So as we go through the form, you can see all the different instructions, and the physician information for the physician-to-physician discussion is also here. So you want to make sure you're having all of these different pieces of information available. So someone asked where it's actually located, and let me show you that. If we open up the website, so I'll actually start a little bit further back than Performant. Now, you could have Performant website, and Ellen will probably throw that in the chat for you if you want, but the Performant website will take you directly to the form. It's actually located on here. It is again decided to give you that, but there's also a lot of other information. Let's start though back at CMS. If I'm on the CMS website, I can go to Research Statistics, Data, and Systems. This is part of, again, the Fee-for-Service Compliance Program. So we'll go under Monitoring, and we're going to select Fee-for-Service Compliant. On the left side, you'll see the list of vertical links. The second one is the Recovery Audit Program, and that's exactly what we're talking about. The reason that I wanted to show you this is it just explains a lot of the information that I really briefly summarized. But underneath there, you can see a list. Now, why is this important? This information updated on March 28th of 2023. So Performant began the Region 2 contract, which again includes Iowa, Kansas, Missouri, and Nebraska. But before that, it was Cotiviti. So depending on when the request review came in, it could be Cotiviti or it could be Performant. Indiana and Michigan, you guys have been under Performant for quite a while, so you don't have to worry about that. But I wanted to point that out. So you can also then select. So if you ever forget who your RAC is and you're not really sure, take a look at the CMS website. Easy way to do it is to type RAC in the search field, and you'll be able to pull this up as well. Once you do bring that up, again, you'll be brought to this website. Without going any further on the Performant website, just scroll down. As you scroll through, you'll be able to open the sample documentation and the additional documentation submission instructions, followed by the discussion request form. So you want to make sure you're aware of all of this information if there's anything else you need to be aware of. Again, these are some pretty important key pieces. You can take a look at FAQs if you want. We'll talk more about the approved issues log in just a few moments, but the discussion request form is available right here. When you select the link, it asks you to download it, which is what I did, and showed you the Word document. So that's where it came from. So can you file a discussion and a level 1 on an automated review? Yes, and a level 1 appeal is available on an automated review, and so is the discussion period. The thing to remember is they're just not as common. So when you really think about it, it's not quite the same thing as the process isn't quite the same. So an automated review, you don't get like a lapse time frame or anything like that. A lot of times what's going to happen is the automated review comes out, the system says, oh yes, there's an error, and then automatically, you know, it sends you a letter. Well, that's great. That's our initial findings letter. And that initial findings letter does start at the time, and you could file a discussion period, but it also triggers it to go to us because it's automated versus complex. And so it'll trigger a request to come to the MAC. The MAC will automatically set up your overpayment. So many times that process is already in place for the overpayment, so people are choosing to use the appeal process. But we don't want you to think you don't have the right to use the discussion period. You very well could. That's completely up to you. Just remember, you still only have 120 days from the date of the overpayment letter to file the appeal. So if you're using the discussion period, again, you have 30 days to get that filed, and then you have to wait, a time frame usually around 15 days or so to get the answer. Sometimes it could be a little bit longer, up to 30 days. So you're 60 days into 120 days before you finally get an answer on the discussion period, which is why it's not as common for an automated review on an initial findings letter. But I also don't want you to think you can't do it. Definitely you can. All right, next question. Someone asked, how do you know if you should do a discussion period versus an appeal? We can't answer that for you. Really look at your business practice. What's best for you? Is it better to have the information given? And we'll give you an example. Did you miss documentation? In which case, again, you can simply send it in through the discussion period. They'll look at it. You don't even have to do a doctor-to-doctor discussion, but by doing the discussion period, the actual medical review can be performed. Now, we're not going to say it's going to be a finding for you. On the other hand, what we are going to tell you is at least it's going to allow the medical review. If you want a second medical review, you're still welcome to do that. How do you do it? File for a level 1 appeal. We can take a look at it as well. So the RAC can look at it, then we can look at it. Better chances of us understanding what you're looking for. So I can't really tell you yes or no to use the discussion period. Again, I can tell you that of the appeals filed on the RAC findings, 75 to 95% of those appeals could have been handled during the discussion period without ever waiting for that overpayment to come. And so by going back to the RAC and allowing them to make that decision. That is one of the most common things that we see. Again, lack of documentation, missing signatures, something like that. It is very common. One question that came up, which is not really related to the discussion period or the appeal, is if I could show you where to find the approved RAC issues or topics log, and I can definitely do that. So two different areas. One, if it's for Performant, which would be your contractor, your RAC, you can scroll down again, and it was right above where we were just at. So I went back to the top, right at the beginning of their website. I'm going to scroll down a little bit. We're going to get down through the general notices, and we're going to come to supporting resources, and there's your approved issues log. Now these, again, CMS has to approve the RAC to look at something. A RAC is not simply allowed to just pick a topic and start going with it. They have to be approved. So once approved, they'll be added to this log. And you can search the log. You can download the Excel file. It'll tell you whether it's automated or complex, and it'll give you all the information you need. So here's one for Region 5. Here's one for Region 1 and 2. So it just depends on what they're looking for. And remember, the RAC does have multiple regions. Region 5 is the national contract, so that would be like your DME and your hospice, a little bit different than Region 1 and Region 2. As I said, there's also another place you can locate this information. So on the CMS website as well, if we scroll back up to the top of the RAC information, so again, we went to research, and then on the right column, we selected the fee-for-service compliance program, and then we selected on the left column the Medicare fee-for-service recovery audit program. If you notice, the second item on the left column actually says approved RAC topics. This is the national topics list, but underneath that you can also see the proposed topics. So these two are really nice. Now, a RAC is not going to put a proposed topic on their website until it's approved. So if you want to know what they're thinking about looking at, this is where you got to come to do that. But if you want the approved, go ahead and select that. And you'll see a full topic list here. Is 176 entries. It will tell you, is it all max, which jurisdictions it's applicable to. So if you're looking at it, you just need to be aware that if it's not applicable to J5 or J8, then that's not going to be applicable to you. On the other hand, if it says all AB max, then it's applicable across the board. So those are the couple options you're going to have there. So for instance, the second one down, does not have J5 or J8 included. Therefore, though, this is a complex review, but not for our states. And I'm just kind of scroll down. You can see again, it's the DME MAC providers, and each one is broken out a little differently. On either issue log, by selecting an issue item, you'll open the details of the log. So here's just an example of that, and anything that's affected and what they're looking at. Again, if you do have questions, please put them in the chat. I'll talk a little bit more about a couple of things, but I want to make sure I'm gathering those questions because we're just about out of the pre-submitted questions. One item that also came up is, do we have information on our website about the RAC? And we do have a little bit of information, but it's actually going to be in the medical review area. Now, this is a portion of medical review, so that's why it goes here. And when you open it up, you'll be able to take a look at the different sections we have. If you're interested in any information, this is where we house all of our medical review stuff. You can type RAC, and you'll see it comes up, other review contractors, and this kind of explains and ties back to how to look up this different information that you may have. Again, with this transition, we will need to get this updated very shortly, but it is just something you want to be aware of. One article that was asked about, and I did show this during the last item a week ago, was this disputing a recovery audit contractor. So I'll go ahead and select that too. Again, it's in medical review and it's in guide, so it is part of that. The article is designed to help you understand, again, the discussion period versus an appeal and whether or not you have the right to do both. You know, which one should you use, all those pieces of information. Again, as a contractor, we aren't going to tell you you should use a discussion period or you shouldn't. We just want to give you the fact that you have the right to use whichever one you so choose. So it's an important key piece of guidance there. All right, Ellen, do we have any questions?
We have not received any questions yet.
Okay, so I'm going to go ahead and jump back to the PowerPoint, but what I want you to know is that, again, if you have a question, I want you to put it in the chat, and I will check back with Ellen in just a few moments to find out if we have some questions for you, or from you, sorry. You will be given the opportunity to take a survey. The survey is simply about this information, about the PowerPoint, the presentation from today's event, and again, keep in mind this is a question and answer session, so no questions means we won't have a lot. We are going to give you 10 days to complete that survey. I do have the wrong date on here. This should be 5/5. We did switch the date of this event. That's why the date is wrong. So if you're looking at this, use 5/5. If you want to take the survey while I sit and talk, feel free to do that. You can either scan the QR code. You can use one of the links provided. Here's a link. And you can take the survey. Go ahead and do that. Follow-up questions, again, we talked about this, 10 days to get those to us. If you think of something else, we'll go ahead and answer those as you go. So please be aware that these will take some time to gather and we'll get the information to you. If we have more, it may take a little bit closer to 30 days. If we don't, it'll be a little bit shorter time frame. Okay, Ellen, any questions?
Tom, we did have the question coming in from Robin. And her question is there always a discussion period offered?
Good question. And you know, to reiterate, yes, there is always a discussion period offered. Let me bring up this form again. So instructions for completing the form. The discussion period will be offered, and it is the review results letter or the initial findings letter. Now, remember the review results letter comes from a complex medical review in which a medical professional, doctor, nurse, coder, someone actually looked at the claim. The initial findings letter is the non-automated review, but either way the discussion period is available. You are able to use the same form for this discussion period. If you want to know where to send it, they give you the information. If you want to do this electronically, they do have a portal that you could use, and I should have probably added this in a little bit ago. On the Performant website, do not use ours to request a discussion period. Please don't do that. But on the Performant website, if you're back on that first page, You can see highlights information. This is going to look a little different because this is actually their primary page. If you want to go to CMS RACs, RAC resources, or whatever you want to do here, I'm just going to select CMS RACs. You can see this secure provider portal. You could actually just put in a discussion period request right here, and it will go to them. They'll get the information. You can upload a variety of files. There's a variety of different ways. So I don't want you to think you don't have other options. You absolutely do. It's just up to you. But yes, any claim that they have found an error with or an issue with is something that you do have the right to do a discussion period on. So please keep that in mind. I also want to highlight this little sentence right here. For those of you that are not aware, if you get to close to the end of the 30 days and you need more time to gather documentation to get your provider ready or whatever the situation is, you can actually ask for that. What they will do is hold off on sending us a notice for the recoupment to take that money back until after it has occurred. So any RAC finding will allow for a discussion period. Ellen, any other questions?
We do have another question. Says, I came in late, so I want to be sure I understand. You can do discussion first instead of appealing if you disagree.
Yes, absolutely. That is true. So when you look at the discussion period, let me make this about as, so that everyone is getting a clear understanding. A discussion period occurs before your appeal rights begins. So here's how it would happen. You get a findings letter, whether it's an initial findings or review results, there's something found on your claim. You get 30 days from the date of that letter to request a discussion period. Now, keep in mind, it is a different process for the review results letter and the initial findings. Initial findings, we open the overpayment right away. Review results, we do not. But you still have 30 days regardless. Doesn't matter. So you get through that. Yep, you chose to file a discussion period. Even if you chose to file that discussion period and the RAC upheld their finding, you can then wait until we send you the overpayment request. Now at this point, if you still disagree, you can file an appeal, which is a level 1 appeal, level 2, level 3, level 4, and level 5. Same appeal rights you would for a claim. Key difference, do not file a claim appeal, you're filing an overpayment appeal. For those of you that are not familiar with that, there's a checkbox that you have to check or you have to indicate to us it's an overpayment. One of the things we want to make sure when you write it, I disagree with this overpayment because. This overpayment should not occur because. Key thing, I'm putting overpayment in there. I'm not saying appeal. You're not appealing a claim determination. That was not what happened. So to answer the question again, yes, you can use the discussion period. Does not affect your appeal rights. Your appeal rights begin with the overpayment. The discussion period begins with the review results finding or an initial findings letter. Two different options. So discussion period first, appeal second. Next question.
Tom, I'm not seeing any additional questions at this time.
Okay, I'm going to give you guys the opportunity to throw some more questions in there, and I want to make sure you have that opportunity. So what I'm going to do is just give you a little bit more information. First of all, if you're doing the physician to physician, doctor to doctor, you'll sometimes hear it called either way, make sure that you do check yes here and you do include the name and credentials. This is important. If you don't have this, the RAC does not have to allow you to do this. So you want to make sure that you will get a discussion period, but it's based on the documentation. Be as specific as you can in this section. Just like when you file an appeal, don't use generic terms. I don't agree with your RAC finding. Okay, why don't you agree? Oh, I missed sending you this piece of information according to the finding. I've attached that information. Make sure you're getting this as complete as possible. Just like you're writing for the appeal, you want to make sure we're getting the complete information. Okay? Let's jump back. Again, over here. Oh, not over here. Sorry, I want the website. Let me go back to that. Give me one moment here. So when you're looking at this, you want to make sure you have everything you need from this, and you want to be able to make sure that the information is there. When you come back and you're looking at this website, you can use our section to file the appeal. That has not changed, and that's a level 1 and a level 2 appeal. But again, You're disputing the overpayment. This is the key thing right here. So make sure that you include that information on there. If you're in our appeals section and you look at our form, just as an example, you want to make sure that you do check that this is related to an overpayment. So let's do the redetermination form. Just let's open that up real quick. You can see it takes just a minute to open, but does this appeal involve an overpayment? This is key. So with the RAC discussion period, you're not going to have this number yet. It doesn't exist, but when you come to us, you will. Don't file the appeal until after the discussion period is complete and the RAC has made the determination and then notified the MAC, and the MAC has requested money back. So hopefully all of that makes sense in that flow and the different things you need to know. Ellen, any other questions?
Yes, we have a question from Catherine. If the initial physician listed for the doctor-to-doctor discussion is unavailable at the time of the call, can another physician stand in?
So I can't directly answer that in terms of how Performant handles it. That's up to them. They have in the past allowed this, but again, we don't really know for sure. We believe that they will allow it and that you may have to indicate this to them and say, hey, this is what actually happened. Provide them a little help to understand why this is, a person standing in. The key thing with this is if another person stands in, they still need to be aware of the case history, the documentation, all of that different type of information that would be available. Any other questions?
We have no further questions at this time.
All right, perfect. So a couple of things I want you to be aware of. If you wanted to see the Performant website and kind of listen to what they have to say, we did just have a presentation from them last Wednesday, so not quite a week ago. That Encore is available. Ellen has graciously put that into our chat feature for you. Definitely want to make sure you're aware of that. If you are interested in sending us a comment, there's a couple of things that have changed on this slide. Again, our date did change. Due to the Performant webinar, we pushed it back a week, so that's why you're going to see a different date. So make sure you have the correct date in there. If you do use the 4/19 date, that's fine. We'll still take it. Remember, you get 10 days to send us any follow-up questions. So that's 5/5. 5/5. After that, what we'll do is compile them and drop them out in an email. That way you'll have them. If there is something claim specific or overpayment specific, that's not something we can research for you. So we need you to go to customer service. That is very specific from CMS, and there are very specific tracking requirements with that, which means, yeah, not going to be able to cover that. A few of you may also have seen that there was a PowerPoint presentation, which I just went through, and then there's another handout loaded. The other handout is an optional material handout. It does cover things like chronic care management, depression screening, what's going on currently in Medicare, and what you need to know. We do recommend that you take a look at that information. It is some new stuff coming up, some different information that is available. We do update that handout periodically, so you want to make sure each webinar you're taking a look and to see what is on there. One last opportunity. Ellen, any more questions came in?
We have not received any additional questions.
All right, perfect. As part of your presentation, I did give you some resources. Now, these are the things that I actually went through, and these are hyperlinks, so you could select any of them, and they will open those pages for you. This should make it a little bit easier to find all of that. I did give you Cotiviti, though they are not the current RAC, they are still finalizing all of the information from when they were the RAC, so you might need to go back and forth. But keep in mind that's just Region 2, which is Iowa, Kansas, Missouri, and Nebraska. Indiana and Michigan, you will always go to Performant. You have been with them a long time. So these are some different resources that you might find helpful. All right. So that's it for this event. What happens next? Again, take that survey. That's what's going to go ahead and complete the course for you. Now, if you choose not to do that, whatever, you're going to get an email from us reminding you, take the survey. When we stop the course, you're going to get a reminder, hey, take the survey. The survey that comes when we stop the course actually is a pop-up box. It kind of looks like it might be a phishing or a scam site or something. It's not. It's going to say WebEx wants to take you to a external, and that's just the survey. It's going to look like exactly what Ellen put in that box for you for the chat feature. You can Go ahead and tell me what you think of the question and answer session, if you got the information you needed, all of that type of thing. So you want to make sure you take that survey. We don't have to wait anymore. Marking complete is not part of the process, so we'll go ahead and get that to you immediately. If you have questions, remember you got to get those to me by noon on the 5th, and we'll get those answered out within 30 days. Again, one last opportunity. Ellen, any questions?
No, we have no further questions, Tom.
All right. Thank you, Ellen. And on behalf of Provider Outreach and Education and myself, I want to thank everybody for attending. You can now disconnect. Have a great day.